Okay. A pleasant good morning to all of our viewers. My name is Kadeen Smith. I'm the project coordinator for the Caribbean Future Forum. Welcome to the fourth episode of our new CaribWebDialogue series, the SDGs and You. This is the fourth in a new series of Caribbean Future Forum webinars that aim at raising awareness of the Sustainable Development Goals, their relevance to the Caribbean, and how we as a region can achieve these goals. Today's webinar will focus on a healthy Caribbean. Yesterday we celebrated World Health Day 2016, which placed an emphasis on diabetes. And I'd just like to share with you a brief extract from the WHO Global Report on Diabetes. It says, the first WHO Global Report on Diabetes demonstrates that the number of adults living with diabetes has almost quadrupled since 1980 to 422 million adults. Factors driving this dramatic rise include overweight and obesity. In 2012 alone, diabetes caused 1.5 million deaths. Its complications can lead to heart attack, stroke, blindness, kidney failure, and lower limb amputation. The new report calls upon governments to ensure that health systems are able to diagnose, treat, and care for persons with diabetes. It encourages us all as individuals to eat healthily, be physically active, and avoid excessive weight gain, end quote. And of course, Sustainable Development Goal 3 is to ensure healthy lives and promote well-being for all at all ages. However, NCDs such as diabetes continue to pose a challenge to the Caribbean region, and statistics even show that 70% of deaths in our region are caused from cancer, diabetes, and obesity. Joining us today, we have Dr. Edwin Bolastig, the advisor, Health Systems and Services at PAHO. And we also have with us Dr. Eldonna Boisson. She is the advisor, Disease Surveillance and Epidemiology at PAHO. They will discuss with us some measures that are being put in place, and I guess some ways in which the Caribbean can take just one step further to achieving SDG 3. And just before handing over to Dr. Bolastig, I'd like to remind you to stay up to date with our activities through our website at CaribbeanFutureForum.com, on our Facebook page, Caribbean Future Forum, and by following us on Twitter at Forum_Caribbean. Please feel free also throughout this webinar to submit your questions in the Q&A box that you see below, and we will have a segment where our speakers will answer your questions. So without further ado, I'd like to hand over to Bolastig.
Thank you very much for the kind introduction, Kadeen. Good morning to all our members of the audience or with us online via the webinar to talk about relevant aspects of a healthy Caribbean as we celebrate World Health Day 2016. I'm very pleased to be here today with my colleague here, Eldonna, who will be providing us the Caribbean perspective of the strategic efforts in the region when it comes to making the Caribbean a healthier region, right? And let me start by greeting everyone once again a happy World Health Day, which we celebrated yesterday, and which is celebrated every 7th of April in commemoration of the founding of the WHO in 1948. So each year, a theme is selected to highlight a priority of public health concern. And this year, the theme is on diabetes. The PAHO slogan for this year is a battle cry to fight diabetes, which is Step Up, Beat Diabetes. So World Health Day 2016 therefore provides a good opportunity for us to advocate for scaling up prevention, strengthening care and treatment, and enhancing surveillance of diabetes. Personally, I'm very pleased with the attention diabetes is getting, because I remember as a child growing up reading the Reader's Digest of my mom. As a child, it was reported that diabetes was a silent epidemic. But now it's not so silent anymore. You know, with the global report focusing on diabetes, I think now diabetes enjoys the kind of attention it deserves at the global scale. So I think it's very important to highlight this at this point as we celebrate World Health Day. So allow me to proceed by explaining a little bit more about diabetes itself. So what is diabetes? It is a chronic progressive disease characterized by elevated levels of blood sugar, or what is called as blood glucose. It's three forms: type 1, type 2, and there's also what you call gestational diabetes. Type 1 diabetes was previously known as insulin-dependent juvenile onset or childhood onset diabetes. And people with type 1 diabetes would require daily administration of insulin as it is characterized by deficient insulin production. So diabetes is currently not preventable because it's based on genetics. However, the complications from type 1 diabetes that's the one that's preventable. In terms of type 2 diabetes, it is formerly called non-insulin dependent or adult onset diabetes. It occurs when the body no longer effectively use insulin. So a vast majority of people with diabetes have this form of disease, right? So diabetes was once associated only with adults. However, it has begun to occur in children. And it is known that type 2 diabetes is largely linked to obesity or overweight, unhealthy eating, and lack of physical activity. So these are the risk factors, for type 2 diabetes, which is really related to to our lifestyles, to the way we live our lives. So that as we said, while it mainly affected adults before, now it occurs among children too. Worldwide, more than 1 in 3 adults is overweight, and more than 1 in 10 is obese. And a local study here in Trinidad and Tobago actually shows that among school children aged 5 to 18 years old, there is a 4-fold increase in the prevalence of obesity, meaning within a 10-year period, such that it was 2.4% in 1999, and by 2009, it has risen up to 13%. So imagine 400%, rise in obesity among our school children. And that is a recipe for, more diabetes cases showing up in the future. However, we need to emphasize that while this is a big problem that we have before us, there are effective approaches that are available to prevent type 2 diabetes and to prevent the complications and premature deaths that can result from all types of diabetes. And this could include instituting policies, right?
Yeah.
And practices across populations and within specific settings. So we talk about what you call the healthy settings approach, meaning at the school, the home, and the workplace. So these are the areas where we could make a difference. If we implement healthy practices in these areas that would mitigate the rise of diabetes and other chronic non-communicable diseases. All right, so what are some of these healthy practices that I think Katie mentioned some of them? Exercising regularly, eating healthily, quitting smoking, and controlling blood pressure and blood lipids or cholesterol, right? So what is the global response to diabetes? In 2011, the Political Declaration on the Prevention and Control of NCDs was made through a UN high-level meeting in New York, and the Sustainable Development Goals for 2016 and 2030 was presented last year, and is being supported by member states. Earlier in 2007, CARICOM member states actually came together to address non-communicable diseases, and they produced the Port of Spain Declaration. So Trinidad and Tobago, being a signatory to this declaration, made a commitment to tackle the common risk factors for the major chronic diseases and improve the care for such diseases as diabetes, among the key strategies to combat NCDs. And we mentioned earlier in 2015, which is last year, national governments agreed on a set of sustainable development goals, including SDG 3, right? Now the global WHO report on diabetes, which was released the other day, shows that governments around the world actually have begun to act, right? However, because of the magnitude of the problem, then a lot more effort, concerted effort, is actually needed. So in view of these, what are the 5 key messages that we would like to share with you on World Health Day? First is that, as we mentioned earlier, there's a huge increase in global burden that diabetes is imposing on populations and families and governments and societies, you know, and at the global scale on the whole, right? Another message that the solutions exist, right? And many of these cases are actually preventable. Third is that there has to be a national commitment to this global campaign. And then we need to talk about health services and the availability of medicines to deal with diabetes. And we're going to talk about the 6 WHO recommendations to address the global diabetes epidemic. So let me first talk about the burden. Kaden earlier spoke to us about the global burden, where there's about 422 million adults that are affected globally at the moment. And there are 4 times more people with diabetes today than there were in 1980, right? So again, we're seeing the 4-fold increase. It's interesting because in the local study earlier, we saw a 4-fold increase in diabetes in the 10-year period. Here, from 1980 to the present, there's actually been a 4-fold increase also in terms of numbers of people being affected with diabetes. And in the Americas, the number of people with diabetes is estimated at 73.9 million, that was in 2015, and is predicted to increase to 109.3 million by 2040. So imagine that the kind of burden it imposes on the economies and on societies. And Trinidad and Tobago, this is our reality here. It ranks among the highest in the world in terms of deaths from diabetes. In Trinidad, diabetes is the 3rd leading cause of death after heart disease and cancers. And in total, as mentioned by Katie earlier, more than 60 to 70% of the causes of deaths actually are to be attributed to NCDs in total. So diabetes and its complications result in significant economic loss to people with diabetes and their families, and to health systems and national economies through direct medical costs and productivity losses. However, as we mentioned earlier, much of its burden is actually avoidable or preventable. So there's a lot of it that we could do to prevent this thing from happening, from stopping the continued rise of diabetes, you know, and mitigating the complications. So in terms of solutions, now I move on. I think that's a good cue to talk about the preventive efforts. It should include policies and practices across whole populations and within specific settings, as I mentioned earlier, the school, the home, the workplace, right? And then also, because diabetes commonly coexists with hypertension, cardiovascular disease, tuberculosis, or even HIV/AIDS, there's therefore a need to have an integrated approach to the management of diabetes, right? So that we'll be able to comprehensively address the situation, right? Because when a patient presents with diabetes, normally they also have other NCDs as well. Or when we have a hypertensive patient, we need to determine whether they might have diabetes as well. So that we'll be able to address both. But because most of the time, the risk factors are the same. Yeah? Okay, and from the health service perspective, there has to be access to affordable healthcare services with equipment that is sufficient to diagnose and monitor diabetes. There has to be patient education to promote healthy diets, physical activity, and most importantly, self-care. Because diabetes is a chronic disease, and therefore a lot of it has to be the intervention needs to happen over a long time. And so the patients needs to be provided with opportunities to be empowered to take care of their own health, right? And of course, that has to be supported with essential medicines for diabetes management. So now we talk about the commitment. To adequately tackle diabetes, what is needed is what you call a whole of government approach and a whole of society approach. Where different sectors systematically consider the health impact of policies in trade, in agriculture, in finance, in transport, education, urban planning, and many other sectors. This approach is what we call the health in all policies approach, and really this approach addresses the various social determinants of health that we have mentioned earlier. Because it's not just health services that impact on health outcomes. We know very well that all these other things, like the way you live, where you are born, the built environment, it's not just your biology that determines your health outcomes. It's not just your genetics, but your living conditions, your working conditions, they all add up. How a certain environment allows you to be able to practice healthy habits. Let's say, for example, how does security or crime situation impacts on your ability to go out early in the morning, do your exercises, run around the block without the fear of on your security or your safety. So all these things contribute to a healthy outcome. The food that children eat in the cafeteria, in schools, or the families when they go for a line, where do they go? What kind of food do they eat? What kind of food do they prepare? So, and how all these things are woven into the daily fabric of daily living, right? So this year, PAHO WHO is collaborating with the Trinidad and Tobago Ministry of Health and the regional health authorities, along with UN and government agencies, including the Office of the Resident Coordinator, of course, and with other private sector agencies, NGOs such as the Diabetes Association of Trinidad and Tobago, the Trinidad and Tobago Association of Nutritionists and Dietitians, the Caribbean Lifestyle Diabetes Center, the National Parents Teacher Association, and many others. And we are seeing that this is what we call a snowball campaign, where as we advocate for involvement in this campaign, a lot more people are actually joining in and sharing with us their own activities. So what we're trying to do is just to coordinate the activities so that the overall effect on at a national scale will be felt, right? And I'd like to quote our PAHO WHO Trinidad and Tobago representative, Dr. Bernadette Theodore Gandhi. I'm here on her behalf. Okay, so let me just say that she's encouraging all stakeholders to play their role in addressing diabetes as a public health challenge. She'd like to explain to us that there's no single policy or intervention that is sufficient to solve the problems, because it's complex, and diabetes imposes on our population, the problems that it imposes is also is varied, and it affects different levels, of our existence. So it is important to remember that if we work together, we can beat diabetes and improve the quality of life of people living in Trinidad and Tobago and the wider Caribbean, right? And it is important to bear in mind that everyone has a role to play in mitigating the impact of diabetes and other NCDs. Okay, so the fourth message is medicines. In order to tackle NCDs, including diabetes, it is important to have access to medicines. In Trinidad and Tobago, essential diabetes medicines and technologies, including the insulin, is actually available through the Chronic Disease Assistance Program that was launched in 2003 by the government. This program also provides glucometers and testing strips for effective self-management that will allow persons with diabetes to live longer lives, right? Now, there was a PAHO study actually before that showed that given the cardiovascular morbidity in the country, we should be seeing a higher degree of cardiovascular mortality. But so they tried to look at what were probably some of the reasons that was dampening the cardiovascular mortality. And then they looked at the factors. There was some indication that the CDAP program, by making available, NCD drugs, actually was dampening on the cardiovascular mortality. So, this is one evidence that would show to us that, by improving the health system, you actually have a direct impact on addressing these NCDs. And probably my last statement before we open the floor, before I hand over the spotlight to my colleague here, Eldonna, I'd like to share the 6 WHO recommendations that talk about the main actions that countries can take to address the global diabetes epidemic. The first is to boost the priority to NCD prevention and control, including diabetes. Secondly, strengthen national capacity to accelerate country response. Thirdly, create, sustain, and expand health-promoting environments to reduce the risk. Fourth, strengthen and orient health systems to address diabetes. We talked about that earlier, like models of care and how you provide these services. The fifth is to promote high-quality research and development. And the sixth one is monitoring trends and determinants and evaluating the progress. So it's very important to follow through, to find out, and again, and establish the evidence for what needs to be done after we would have implemented our interventions. Okay, so thank you very much. And at this point, I'd like to, as I said, share the spotlight with my colleague here, Eldonna, who will share with us the Caribbean perspective.
Thank you, Edwin. And good morning to everybody, and thanks for having me here today. I'm not going to speak for as long as Edwin did because he's just sharing a little piece of the spotlight. But what I would like to do today is to just share a little bit with you some of the mechanisms, main mechanism that the Caribbean as a whole is using to tackle NCDs and communicable diseases as well, but focusing on NCDs. Because, of course, we're all very small islands or countries in the Caribbean, there's some things that we would benefit by working together on. We have a long history of doing so. Because of our economies of scale, there's some things that it does not make sense for us to try to tackle individually. So you're probably familiar with the Caribbean Cooperation in Health. This is the actual regional framework through which the member states of CARICOM cooperate with each other, with regional institutions, with development partners to improve the health and well-being of Caribbean people. The whole concept promotes a collective and collaborative approach to solve critical health problems that have been identified as a priority and that would benefit from the regional approach, rather than by having these problems addressed by individual countries. The Caribbean Cooperation in Health, or CCH, was actually adopted by the CARICOM health ministers back in 1994, and really aims to optimize and utilize local cooperation amongst the countries of the Caribbean to develop and secure funding for the implementation of the projects that have been identified as priority areas. It's really one of the significant achievements of the regional integration process. So, why did we think of having CCH to begin with? Well, it fulfills the CSME expectation on issues of regional integration from common standards to centers of excellence. And I'll come back to one of the centers of excellence that was born out of the CCH initiative. It acknowledges capacity gaps in many member states and provides opportunities for solutions in a collective manner. It's a regional reference document for partners as well as for donors, and it's a roadmap for regional health institutions like ours, PAHO, and others in the UN. It's also a guide for countries for inter-country cooperation. Some of the successes, we've now had 3 CCHs. We're just about to develop the 4th. In the first CCH that was adopted in 1986, it recognized the region's eradication of indigenous transmission of measles, so we don't have measles anymore. CCH2, that spanned the time of 1999 to 2005, recognized the scaling up of the national and regional response to HIV. We know we've made a lot of strides in that area. CCH3, which ended last year, it spanned 2010 to 2015, gave 5 areas for functional cooperation and 8 priority areas. Some of the functional approaches are, they could, or were rather, creation of a healthy Caribbean environment conducive to promoting the health of its people and visitors. Edwin discussed a lot about that healthy environment that would promote health. The second functional approach was improved health and quality of life for Caribbean people throughout the life cycle. So, from pregnant women to the elderly. And again, we're seeing a lot of NCDs, including diabetes, emerging, not just at the elderly scale, but also amongst children, as Edwin said. To have responsive health services that would effectively meet and adapt to the needs of Caribbean people and the changes that they go through. Again, we have some examples of that with CDAP and so forth for the NCDs. To have human resource capacity to develop to support infrastructure development in health in the region. That is probably remaining as one of our biggest challenges, to get that human resource capacity that we need, because we're small, we don't have many people. And evidence-based, the last one is evidence-based decision-making to be the mainstay of policy development in the region. So we want to look at the evidence, we want to look at the figures, the mortality, the morbidity that Edwin referred to, and make our decisions based on that. There were some specific programmatic areas, and they're very much intertwined. Some of them, for example, non-communicable diseases, environmental health, food and nutrition, mental health, family and child health, human resource development. Communicable diseases, of course, was another priority area. So all of these, they're all very much interlinked. They're not independent. In CCH3, we also had quite a lot of success. We spoke about one of the agencies that was born out of it. That is the Caribbean Public Health Agency. The director, Dr. Astidada, speaks about it as the only new public health agency of the 21st century. So that was born out of CCH. In terms of NCDs, the continued progress towards implementing the commitments to prevent and control NCDs. From the Port of Spain Declaration that Edwin referred to, we also have HCC, the Healthy Caribbean Coalition, that was born in 2008, another success. Building capacity in human resources, remember I said that was a challenge. We have the CXC regional examination for nurse registration. We've had an extensive analysis of the workforce that we did at PAHO in 2011 to identify gaps. Increasing capacity of lab services for the Caribbean, which we need, of course, to support our fight against NCDs. We have Caribbean Wellness Day, and those are some of the successes of CCH3. Of course, we have some challenges. We have to work on our indicators. We found it a bit challenging working with the indicators we had for CCH3. They're a little bit difficult for countries to be able to address. The M&E and accountability framework is a little bit difficult, so it's not so easy for us to determine how well we have progressed with CCH. So that's something we need to work on. And of course, even though we're pooling our resources, our countries are very diverse in the Caribbean in terms of population size, in terms of the kinds of health system needs they have, in terms of the political geography. And so to come together with a common regional good that fits all those different categories can sometimes be a challenge, but we work towards that. And so recently, in February, we had a meeting in the Hilton to now look at CCH4, because that's the next development that we have to do. And we wanted to try and determine what are our priorities for CCH4. We had a huge cross-section of stakeholders. We had all the chief medical officers of the region, we had donors, we had NGOs, we had other partners, other regional institutions, so really a wide cross-section. And we came up with 5 proposed priority areas for CCH4. One is health systems for universal health coverage. As Edwin discussed, essential for combating diabetes and the other NCDs. Second is a safe, resilient, healthy environments to mitigate climate change. But the safe, resilient, healthy environments will do more than just mitigate climate change, of course. It will also help us to deal with the NCDs.
Social determinant of health.
Absolutely. third was health and well-being of Caribbean people throughout the life course. So this is one that is carried over. The fourth is data and evidence for decision-making and accountability, again, a carryover. And five, very important, partnership and resource mobilization for health. So we have up to September of this year to complete the development of CCH4, because in September what happens is we present it to the health ministers in Washington, hopefully for their approval, so that we can get on with the business of implementation. So I'm going to stop here because I'd like to leave a little bit of time to deal with your questions and able to respond. Thank you very much.
Okay, thank you very much to both our speakers. And I would just move quickly into the questions. So the first question is, would you agree that many of these diseases have a lot to do with culture and tradition? And what can we do to change mindsets and help make a sustainable change? Sure. Who would like to?
Okay.
Ladies first.
Yes, I agree. A lot of these are linked with culture. I know, I think of my grandmother and my parents, they might fat chubby babies. The baby's too small, they don't think that's a good thing. In some countries, men like to see their women with a little meat on them. How much is a little? So yes, I agree. Culture has a lot to do with how we change it. That is much more difficult because we're talking about a behavior change. And, we're all adults and we know it's hard to make this change what we do. Maybe targeting children may be one of the things, so that as they grow and they develop their thinking and develop into their culture, they grow with this change. I think maybe that would be easier than trying to change adults who we're already set in our ways. It's difficult for us to change behavior without providing, having some sort of penalty. And it would be very difficult to have penalties for the kinds of changes we're looking at, the kinds of lifestyle changes, eating habits, exercise habits, and those types of things. So maybe targeting children.
Yeah, well, I guess that is one a very good strategy, I think, because we have to start them young, right? And so that because it's not easy to change behaviors, so really we have to start them young. And I agree with you, culture is one of the social determinants, right? So we know that a lot of Caribbean cultures have the carnival culture. So what is a carnival culture? It's associated with food, right? And with the kind of food that we prepare during these occasions. Maybe there's something that we could do to actually impact on that, and maybe we could prepare more healthy food. And also, of course, it's linked to alcohol consumption as well. So how do we try to influence that kind of behavior, right? So a lot of advocacy has to happen, a lot of education, awareness needs to be put in place as to healthy options. I think that it's, let's say, for example, in schools, again, going back to our children, there needs to be standards. I know in Trinidad and Tobago, they've actually come up with a color coding system where they have identified what foods are actually are being encouraged to be served, especially that there's a lunch program, a free lunch program. The food box, the box lunches that we're providing to our school children, and even for secondary school. There are, the guidelines now that will tell you what should be in it, what should not be in it. And I think that's a good step. Yeah.
Thank you very much. So I'll just move along to the second question. So it's important that WHO has singled out the issue of NCDs. However, as important as the improvement of the health system is, why does the emphasis not be on the sectors that make available foods that foster poor health? So, for example, there was a direct approach to dealing with tobacco use by ensuring greater awareness by people of the dangers of tobacco with warnings placed on the packaging. So why not do the same for the sale of fried chicken or other high-content fatty foods? Can we make it obligatory to make fruit available in schools? These approaches would be a much more direct route to dealing with the issue, and what would be your view on that?
Yeah, I think a lot of effort actually is being made in that. I know that the Minister of Health, for instance, met with the manufacturers, so that there's some kind of negotiation going on in terms of, reformulating, the kind of food that will be put out in the market, so that there's lower salt levels and there's lower sugar levels. Yeah. So I think it's being done. But you see, these types of changes don't happen overnight, because it's a lot of negotiation, a lot of bargaining. And again, what are the incentives? I mean, we have to be very creative in the way we deal with it, because what is the incentive for manufacturers, so that while they provide healthy options to the market, to the population, that their bottom line is not affected? Because in any business, because we also need to be cognizant of the relationship, the direct relationship between health and trade. So that while our objective is to ensure that there are healthy options out there, we cannot compromise also the businesses, because they're important for economic development. So there has to be some kind of a marriage between both objectives, and I think there are ways to do that. Yeah.
Okay, so good question. Thank you. SDG target 3.4 calls for reduced premature mortality from NCDs. How can measures be implemented at the various school levels to reduce the rate of diabetes in young people? Maybe.
Yeah. Okay. We've talked about some of them, and let me just add a little bit more. I know that for those people who have been identified with who are obese, right? When you do screening, there's an ethical obligation to do something about it, right? So that what what both the Diabetes Association of Trinidad and Tobago and what the Ministry of Health they're doing is that they have what we call obesity camps. Well, obesity camp might not really sound very well, right? But anti-obesity, maybe wellness camps we should call it, right? But these are camps where, for example, the Diabetes Association, for those kids who have been diagnosed as, very young kids with diabetes, they're taught healthy habits, how to take care of themselves in terms of their medications, and I mean, this is really the height of empowerment, ensuring safe, self-care, and how they would prevent the secondary, complications, and then for those obese children who don't have the diseases yet, but who are at risk of developing, there are actually what we call the anti-obesity camps or the wellness camps, to teach them about healthy eating, about exercise, and making healthier choices. Yeah.
And if I could add, that is also a two-pronged approach, because when children learn, not only is it part of them, as we're talking about, it's changing their thinking while they're still moldable, but they take it home. So they go home, those of you who have children will know what they learn at school, that's the law. And they're very happy to come home and tell the parents, Miss said that this is how we like to do it. So they take it
true. Yeah.
It spreads.
The thing about fruits in schools, do you know that we get notices? The kids tell us, my teacher told me I have to have more fruits in my box in my lunch kit. So it's happening actually, and it's happening. And as you said, it's a lot of using the kind of channels. Who are the role models? So the teachers, they're the role models. So whatever they say, it's like Bible to these kids. So the teachers should be saying the right things, and advising the right, the right practices or the right interventions for these kids. Yeah.
Okay. So I'll just move quickly along in the interest of time. With all the initiatives being done, would we be able to get a proper diabetes registry and, I guess, improved collection of data pertaining to the number of persons resulting in complications of diabetes, such as the number of amputations, etc.?
Yeah, there is a lot of work being done in that regard in the Caribbean. PAHO, in collaboration with Caribbean Public Health Agency, is working on different non-communicable disease registries. So not just for diabetes, but also for cancers and other NCDs as well. There's been some big strides made in some countries. and the best practices from those are being used as we expand to others. So that is very much underway, and I think we'll be able to get more and more reliable evidence as time goes on. Sure.
That's certainly encouraging.
Yeah.
Thank you. And since health is a precondition for well-being and productivity, and many of the social determinants of health are closely linked to the SDGs, reducing health inequities or inequalities should be an integral part of the intersectoral planning in the Caribbean. So what would be your view on this?
Well, I agree 100%. That's the whole essence of the social determinants of health. Equity. I just wanted to make a distinction between equity and equality, right? Because we say that health is a human right, right? And everyone should have the same rights. There should be equality in terms of these rights. However, we have to make a distinction between equity and equality, because equality means having the same uniform. Let's say, let me just in terms of, let's say, for our kids, allowances for our kids. I don't think that it would be appropriate to give the same amount of allowance to a kid, to our child who's just in preschool, the one is in high school, and the one in college, because they have different needs, and their different needs would require that they have different allowances, right? It's the same thing with health. People have different health statuses, people have different health needs. So therefore, they cannot have the same, let's say, amount of health intervention that they could get, because that is not responding to what they need. So health equity, what it's trying to say is that you provide what's needed, what's appropriate, you provide access according to the needs of each individual. So social determinants of health clearly addresses the issue of health equity. Yeah.
Thank you. And maybe we have time for 2 more questions. So one of them would be, are there any social programs at grassroots level on NCDs that you would know about possibly?
Oh yes, there are a lot going on. You can see my indication, my simple indicator here is how many people are going around the savannah on weekends. You know how many walk around, I mean, how do you call that, fun runs, marathons, all these healthy activities, being done, in different areas. And I can imagine that it's not just at the savannah that's happening, it's around the country. And we would have heard about, these initiatives before, where you close off part of the road so that people could have healthy activities on weekends. So that's part of the whole, I think, the Caribbean Wellness Initiative. And that's happening all around. So there's a lot of initiatives actually that are happening on the ground. And usually it's in partnership with other agencies.
I just love to say, often we have a lot of agencies like Rotarians and Lions and Red Cross and all of these, and they work very much at the ground level, focusing on community development. Just recently here in Trinidad, I could tell you, for example, it's a little bit aside, it's communicable diseases. The Rotary has reached out to the ministry to ask them for training in community intervention to battle the mosquito that is transmitting Zika. And they have approached the ministry. And so they're going to train them, and they're going to be out in the field amongst the communities trying to promote how people should be able to reduce their breeding sites, for example.
And I can imagine there are also other groups that are doing like backyard gardening, grow boxes, because that also impacts on access to healthy options like your vegetables. So there are actually, the thing is, I think what's happening is that word about these things are not coming out into the open. People are not aware of really what's going on. And also, these efforts are not being coordinated. That is why, and being documented, so that we're able to actually quantify or measure the kind of impact it has on what we did last year was to engage a consultant to do some case studies all right, on health promotion activities going around. I think as a consultant is actually in Tobago right now to do that. You know, so as the word, as these documents are going to be prepared and finalized, we'll share with you so that the word will go out.
Okay.
In terms of what are these things that are being done in the community now. Okay.
Right, and then the last question that we will be able to answer, what role, if any, can CARICOM play in reducing the regional NCD rate, specifically diabetes?
Well, I think CARICOM is using this CCH mechanism as one of the main mechanisms to get countries to work together, to have technical cooperation amongst countries with regional partners and so forth. I think CARICOM's role is mostly one of coordination, engagement of the correct partners, linking in with the donor community. CARICOM would not be the ones implementing in the field, but they will be the facilitators, the coordinators.
And they provide the strategic direction.
And the strategic direction, exactly.
Okay, well, thank you very much. I would like to extend, of course, a heartfelt thank you to our speakers, Dr. Bolastig, Dr. Boisson, sorry. I think this was a very, very informative session, and there's something that we can all take away as individuals, because we have to remember it starts there. So I think we can also take away that individual action that we need to take, and there's the community level activities that we can also engage in and be a part of to help fight these NCDs that continue to plague our region. I'd like to thank our viewers and our partners, the Caribbean Future Forum partners. Of course, please stay tuned on our website, CaribbeanFutureForum.com. Continue to follow us on Facebook and Twitter, and you'll be kept updated with our future webinars. Thank you again, and
Pleasure is ours.
Yes, do have a great day. Thank you.
Okay, thank you.